Hi, Miss Berry. I'm Bryce. I'll be your physical therapist today.
Hi.
How are you doing today?
Great.
Good. Before we get started with the hands-on treatment, I want to do a little bit of a subjective examination. So I'm just going to ask you some questions. That'll take about 15 minutes. And then from there, I'll get a better idea of what's going on with you and what's bringing you in. And then we'll go to the physical exam. That'll take another 15 to 20 minutes. Is that okay with you? Perfect. So before we begin, you can just confirm me your name and your age, please.
My name is Katie Berry, and I'm 58.
Perfect. Okay. So Miss Berry, what do you do for a living?
So 2 days a week I teach at the community college. I'm an English professor.
Okay.
And then 2 days a week I'm like at home preparing all my things for school. And then I'm a spin instructor for 3 days a week.
Okay. And while we're talking, let me write some things down just so I can remember everything. Is that okay with you? Okay. So when you're working and like preparing for your lessons as an English instructor, what kind of things does that involve? What kind of tasks do you have to do?
A lot of computer
Okay.
work, pretty much just on the computer.
Computer work. Okay. And then is your referral that you came in with said kind of pain kind of back of your head and headaches? Is that interfering with your ability to do that sort of stuff?
I'm sorry, can you repeat that?
Yeah. So the referral that your doctor wrote said that you have pain kind of in the back of your head, and it kind of comes around, and you get headaches kind of in the front part of your right side of your head. Do those headaches and that pain limit your ability to kind of prepare for lessons?
It's more for when I'm a spin instructor,
Okay.
but I do feel it when I teach too, but it's just worse whenever I'm
Worse when you okay. And then so when you're in spin instructor, when do you feel it the most?
So it's like whenever I have to like look up and like tell them to do something.
Okay.
Especially if I have to do that like over and over and over.
Okay, so kind of looking up.
Yeah.
Okay. And then besides being an English teacher and being a spin instructor, do you have any other hobbies?
Well, I do like to do poetry.
Okay.
I like to write poetry.
Very cool. Very cool. Have you been able to write poetry with the headaches?
No, the pain I just don't write anymore ever since I've got this pain.
Okay. Okay, so you haven't been able to do that?
No.
Okay. And so do you, so on this paperwork that you filled out, thank you for doing that for us, Miss Berry. So on the body chart here, it said that you were feeling the pain kind of in the back of your head and kind of coming around to the front.
Mm-hmm.
Is that
Yeah.
correct? And the way I drew it right there, is that?
Yeah, right, like, yeah.
Okay, got it. Thank you. I just want to really make sure that's correct. Right now, we're understanding the same thing. So, do you have any pain kind of going on the left side of the head at all?
No.
What about anything going down your back?
No, not down my back.
Not down your back. Anything down that right arm?
No.
And the left arm?
No.
Oh, okay. So, do you feel like there's a relationship between kind of that neck pain that you get and the headaches that you experience?
Yeah, I definitely. So I don't always have the headache, but it's like the worse my neck gets, the worse my headache will start to come on this side.
Oh, okay. So you mentioned that looking up while you're in your spin class, while you're instructing, that aggravates it. Is there anything else that kind of irritates your head?
It's mostly looking up, but yeah.
Okay. And then you said it was kind of repeated. Is there a certain amount of time?
Well, sometimes if I hold it for a while.
Okay.
And I don't have to pay attention to how many
Okay. So when you do start to experience kind of the neck pain and the headaches, what do you do to kind of ease the pain?
Well, I just rest, just, relax and take some ibuprofen.
Okay.
600 milligrams.
Okay. And do you feel like the ibuprofen helps?
Yeah, it definitely helps.
Okay, good. Okay. And when you're resting, about how long does it take for your headaches and your neck pain to go away?
I haven't really paid attention.
Okay. As long as it helps, right?
Yes,
All right.
that's all that matters.
So kind of thinking about just a normal day, when you wake up, how does your neck feel and how does your headaches?
It doesn't really feel that bad in the morning. It feels fine. But yeah, it feels better.
Okay, and then if you're going, say, to give an English class, how does your head feel and your neck feel throughout that day?
So whenever I'm working, whether I'm doing spin or teaching, it gets worse. Both my
Both of them do.
Yeah.
Okay. So your neck gets a little bit worse and your headaches come on. Okay. And then after the workday, you come home. How does your head and neck feel?
I still have a headache whenever I come home from after work.
Okay.
So.
So I noticed on the form that you filled out, and thank you again for doing that. That you said that you experience headaches, and sometimes those headaches limit your ability to sleep. Is that correct?
Yes.
Okay. And are you able to fall back asleep when those wake you up?
I'm sorry.
So when you're asleep and you are woken up because of your headache, are you able to fall back asleep afterwards?
Yeah, I'm able to get back to sleep.
Okay. So do you know how much time it takes to you fall back asleep?
I haven't timed it, but it's not a really long time.
Okay. And so, again, looking back at that sheet that you filled out for me, I noticed that you said that your family has a history of high blood pressure.
Mm-hmm.
Have you and your doctor ever picked up anything then?
No, he hasn't. My blood pressure has been fine so far.
Good, excellent. Definitely something to that I have to ask about. I also noticed that you said that you have attention deficit disorder.
I do.
Okay. Is your doctor aware of that?
He is. I'm not taking medication for it. He knows.
Okay. Do you feel like it interferes with maybe your daily activities?
Not significantly.
Okay. So sometimes I can talk pretty fast. So if you ever don't catch something, right, feel free to interrupt me and stop me, and I'll repeat myself. Okay. All right. I also saw that you said you were feeling down recently because exercise is really hard.
Yeah.
Is that more due since the last couple of weeks because of the head and neck pain?
Yeah, it's just like spin. I really love to do my spin class,
Right.
and this seems like it's made it so much harder. It's just kind of like,
Okay. So do you feel like exercise would be easier again if your neck pain, your headaches were gone?
Definitely.
Okay. Well, good. Well, that's definitely a good goal, right? We can get back to that. So did you get any X-rays, any MRIs prior to coming?
No.
Nothing.
No, I haven't done.
Okay. You don't need them by any means, but sometimes the doctors like to order them before they send you to physical therapy. Not a big deal either way. And then Tylenol, you said you were taking 600 milligrams. Is that the only medication you're taking?
Yes.
Okay. So tell me a little bit more about kind of when the neck pain, when the headache started, the pain started from those.
Well, the neck pain I've had for a few weeks now, maybe like a month and a half, and the eye pain is new. It just kind of started coming on maybe a couple weeks ago.
Okay.
and I can't really think of any time that I like hurt my neck. The only time that the only thing I can think of is I was watching a meteor shower,
Oh,
and so you're like looking. I can't do it.
yeah,
But, you're like looking up,
yeah. I remember seeing that.
Yeah.
Yeah.
and that's the only thing I can think of that may have caused this.
Okay. So prior to the month and a half of the neck pain, the 3 weeks or so of the eye pain, have you had any neck and headache pain before that?
No.
Okay. So let's. I want to make sure that we're focusing on the right things. I want to make sure that I really understand kind of your goals for physical therapy. So what would you like to get out of therapy?
Well, definitely want to be able to keep doing my classes, and I want to get back to writing poetry again.
Okay.
And I just feel like if this went away, I would be able to do that better.
Okay. So writing poetry, and get back to the spin class. Perfect. So do you? So kind of at the end of the hands-on treatment, I'll give you some exercises to work on at home, and I can give you videos. I can show you in the clinic how to do them. We can do them together. I'm going to give you pictures to take home. What would you prefer?
I'm a visual learner.
Okay, so I would definitely make sure we give you good pictures, right? And I'll demonstrate the exercises, and you can do them as well. And we'll make sure that you have a good understanding of how they're supposed to look when you go home. Okay. All right. So next, we're going to be moving into the kind of the hands-on part of the exam. Before we move on, do you have any questions?
Nope.
No. Okay. Sitting right here now, on a scale of 0 being no pain at all, 10 being the worst pain you can ever imagine, how is your neck pain right now?
It's at probably about a 2.
Okay. And eye pain?
It's at a 1, I guess.
1. Okay. All right. So, if you could for me, the first thing that I'm going to ask you to do is just stand up for me. Excellent. Okay, you can go ahead and sit down. Thank you very much. I was just taking a quick check at your posture. And so I know we talked about kind of the looking up. Is there a specific way you look up that brings on the pain, the neck pain?
Yeah, like I would be kind of like, it's kind of weird though, but it's the worst whenever I have to like do that.
Okay. And where do you feel that pain?
It's like right down here.
Okay, so right kind of the back.
Yeah.
And do you feel it at all in the eye?
If I did that for longer, I would.
Okay. All right. So I want to take. I just want to see how your neck is moving, and take a couple measurements. So if you could just put both feet on the ground flat for me. Excellent. And I'm just going to sit right here beside you. So I want you to look up as far as you can. Okay, excellent. And just stay right there. All right, perfect. Come on down. Good. And then I just want you to look down at the ground for me. Good. Good. Come back up. Excellent. And then, do you have, if you would, just kind of bring your right ear to your right shoulder. Good. Any pain or anything there?
It's just a little tight.
A little tight where?
Like, I don't know, it's kind of hard to tell. It's over here.
Okay. And what about the left ear to the left shoulder? Anything there? No. Okay. So next, I'm just going to measure the rotation. So that's going to require me to come behind you and kind of sit this on your head. Is that okay?
Okay, yeah,
All right.
that's fine.
So if you could, go ahead and turn toward your right, please. Very good. Thank you. Come back. And go ahead and turn to your left. Good. And did you feel anything in your neck or in your head there?
No,
Doing those?
I think that was okay.
Okay. So for this next part, I just want to see kind of how some of the smaller joints of your neck are moving. It will require me to place my hands on your head. Is that okay?
Yeah, it's fine.
Okay. If you could, go ahead and lay down right here for me. Yeah, on your back. Thank you. Then I'm just gonna raise you up. Please excuse my creaky table. I'm a low budget clinic. Yeah. Okay. So I am just going to be seeing how your head and your neck are moving. If you feel any symptoms while I'm doing this, please speak up. Okay.
Okay.
All right. This shouldn't be painful. It's just feel like nice, easy motion. Okay. So go ahead and lift your head up for me. Excellent. Go ahead and relax. Okay. So I'm going to start way up here at the top. Okay. Anything there?
No.
Okay.
My pulse like stiff.
Stiff there?
Yeah.
Okay. Any pain with that?
A little.
Okay. And then what if we work down a little bit lower? Anything there?
I think that's fine.
Okay. Nothing down there?
No.
Okay. So next, I'm just gonna see how I relax your head. Perfect. So I'm just seeing how each of those vertebrae are moving, right? Any pain with any of this?
No.
Okay. You said that when you do experience neck pain, it's kind of up higher on the right side?
Yeah.
Okay.
It's at the top of my neck.
The top, okay. Okay, I'm just gonna write some stuff down, I'll be right back. Okay. So next, let's I want to see how strong some of the muscles are, okay? So what I'm gonna do, I'm gonna kind of grab your head and kind of bend it up a little bit, and I'm trying to see how strong the neck muscles in the front of your neck are. Okay, so I'm going to put you in nod for me. Good. All right, in that position. Okay, and I just want you to hold that for as long as you can.
Okay.
All right, go ahead.
This is kind of hard.
All right. So not bad, not bad. How did that feel?
It didn't hurt. It seemed okay.
Yeah. Did you experience any pain or any symptoms with that?
No.
No? Okay, good, good. All right. Next, what I want to do is I want you to go ahead and flip over onto your stomach for me, okay? I'm gonna move this, and place your head right in that face hole right there, okay? And are you comfortable there?
Yes.
Okay, so what I'm gonna do, I'm just gonna kind of continue, oh, thank you so much. Just kind of continue to feel around the area where you're having symptoms and see if there's anything that if I can find kind of any sensitive areas, okay?
Okay.
So same thing, again, this will require me to put my hands on you, is that okay?
Yes.
All right. So I just want you to tell me if there is any change in symptoms or if anything feels strange, okay?
Okay.
All right. And again, when I'm kind of palpating, right, it should just feel like light pressure and shouldn't be any pain, all right?
Okay.
Okay.
That kind of feels like stiff. Like it hurts a little.
Hurts a little up here?
Yeah.
Okay. And what if I come down a little bit?
Down there, it's not. It's fine.
Okay. So no pain up here? If I come off to this left side, do you feel any pain?
It feels pretty stiff.
Okay. And again, I know your symptoms are up higher, but I just want to make sure we're getting a good look at the whole area, right?
Okay.
this right side. Any change in your symptoms here?
It's just when you're at the top.
Just at the top.
You know, kind of stiff, also a little painful.
Okay. So I'm just going to palpate some muscles in that region, okay?
Okay.
Anything here that's tight?
No.
No? Okay. What about going kind of down the back a little bit?
No.
No? Okay. What about muscles kind of at the base?
That feels pretty sore.
Pretty sore up there? Okay.
Yeah.
Okay. Those are called your suboccipitals, right? They're little bitty muscles up there. But they do kind of help your neck and your head to move a little bit better. So we can definitely take a look at those, and I'll give you some exercises that can help you out with those, okay?
That'd be great.
All right, so next, I'm going to do another assessment, so I'm going to stand to the side of you, okay?
Okay.
All right. And same thing here. I'm just going to put a little bit of pressure. I just want you to tell me if you feel anything, okay?
When you're at the top is when it.
Okay. So I'm at the top. You feeling symptoms change or can you describe?
It's the same feeling. It's like I can feel it down here, and then I feel like my eye thing is just starting.
Oh, okay. So you're actually getting some headaches too?
Yeah.
Okay.
Yeah, like when you go harder, I can feel it in my eye.
Okay. Okay. So you're getting some reproduction. So I'll get off of that guy. Okay. And nothing when I go lower?
No.
Okay. Okay. All right. So let me write that information down. You just relax for me. Okay. All right. So go ahead and sit back up for me. We'll just come off this way. Good. Any lightheadedness or anything?
No.
No. Okay.
It's a long way
Yeah, it
down.
was a long way down. So the headache and the neck pain you were getting when I was pressing down, is that all gone now?
I mean, it's not completely gone, but it's better than when you're pressing on it.
Okay, good. So next, so we kind of looked at how the bones are moving. I want to see how strong your muscles are. Okay, so I'm just going to test some of your neck motions, and so I'm going to place my hands kind of right on your forehead and on your temple. Is that okay?
Yeah, that's fine.
All right. So first, I just want you to kind of push into my hand. So go ahead and push. Good. Hold. Good. And next, we're going to do, we're going to bring your head back this way. I'm just going to push, okay? So I just want you to resist, okay? Hold. Good. All right. And next, it'll be kind of rotation. So we'll go to the right first, right? You're going to press into my hand. All right, so press over here. Good. Hold. Good. And one more time to this side. Good. Hold. Very good. Have any pain with any of those? No, good. They felt
Well, actually, like when the first one, whenever I was like
when
doing
you're
it,
looking down
yeah, I felt just like it wasn't that much, but just a little.
on the back side.
Yeah.
Was it kind of all over, or more on the right, or more on the left?
I think it was more on my right
Okay,
side now.
okay. All right. So I think with all that, I have a pretty good idea of what's going on.
Okay, good.
Yeah. So before we move on anymore, do you have any questions for me?
No.
Okay. Sitting here right now, kind of after all that, before we talk again, where on that same 0 to 10 scale, how would you rate your neck pain?
Well, I think it's probably about the same.
Okay. And what about the eye or the headache?
I think it's the same.
Okay.
It's when we started.
Okay. So no better, no worse.
Yeah.
Okay. So obviously, you're experiencing the headaches. I think that the headaches are coming from kind of hypomobility, the joints in the back of your and your neck aren't moving very well right now, and the muscles back there are kind of tight. Some of those ones that I was touching on in the back. So I think if we stretch those and kind of get the joints moving, the muscles working correctly, the headaches and the neck pain should both go away.
Oh, that's great.
Yeah. So I think as long as you know, and I know you're a hard worker and you have you're very very busy with the spin class and with the English classes, but I think if we come in 2 times a week for about 4 weeks, then we can put a really good dent in this, kind of see where we're at there. So with the rest of our time today, why don't we go ahead and get started on treatment? So the first thing that I'm going to do is kind of work on stretching some of those muscles that are tight in the back of your head. Okay. So I'm going to put this back there. You go ahead and lay down on your back. Excellent. I'm going to raise my squeaky table back up. Okay. So what I'm going to be doing here, I'm going to kind of hook my fingers in kind of at the base of your skull where you're having some of that tenderness, and I'm just going to give it a little bit of a pull. Okay, and what that's going to do is stretch those muscles that are a little tight. Okay, it should give you lots of relief. If it is painful, right, or it's reproducing your headaches or your eye pain, tell me and we'll relax. Okay.
Okay.
All right. So go ahead and just relax. All right, how does that feel?
That feels fine.
Okay. Any pain or anything while we're doing this?
No, it feels good.
Okay. Okay. Relax. Good. Let's go ahead and do that one more time. Okay.
Okay.
And then it's your turn to work. I have a stretch for you to do as well.
Okay.
All right. So, okay. So let's do that one more time. All right. That feeling okay?
Yeah, it feels good.
So next, for this next one, you go ahead and sit up facing this direction. Good. Okay. Sweet potato. Gotta love them. All right. So this next exercise is called a snag. Okay. And so I'm going to give you this towel, and what you're going to do is kind of put it on the kind of the base of your skull where my fingers just were. Okay, and you're going to kind of rotate yourself, and that's going to stretch that whole area and open it up, make it move better. Okay, so I will give this to you. Good, and yeah, try to hook it under your hair if you can, just so it doesn't move as much. Good, and kind of right at the, so I'm going to move this, good, and then you're going to rotate all the way as far as you can, and then give yourself a little bit of pull at the end. Good. Does that feel okay?
Yeah. I feel the stretch.
Where are you feeling the stretch?
Like over here.
Okay, good, good. All right, I want you to hold that for about 30 seconds, okay?
It's a nice weather we're having.
The nicest weather. I have to tell you, remind me to tell you a funny story about my friend Erica later.
Okay.
She is fantastic,
Oh, really?
and she is the best. Yeah, Erica is wonderful. Wonderful. She's kind of my hero.
Oh.
So you go ahead and relax. And then I want to go to the other side as well, okay?
Okay.
All right. I'm just going to bring that down. Perfect. And then rotate all the way as far as you can to the right. Good. And just a little pull. feeling the stretch?
Yeah, same place it's on the other side.
Right, perfect, perfect. Okay. Okay, perfect. Go ahead and relax. So, did the stretches feel okay?
Yeah, that felt good.
Do you feel like that's something you can do at home?
Yeah.
Okay, good. You have a towel or a belt that you can use?
Yeah.
Okay, and like I said, I have the pictures printed out for you. They're waiting at the front. We'll make sure we get those
Okay.
on our way out. So the last thing I want to do before I let you go, I want to do the functional sign you showed me earlier. So when you were on all
Okay.
fours and looked up,
Mhm.
I just want to see if that's feeling better, the same.
Okay. So you guys want me to do it again?
Yes, please.
I feel like we can go a little bit further than I could a while ago.
Okay, you feel like you can go a little bit further?
Yeah.
Okay, good. Good. And then after doing the exercise and the hands-on technique, on that same scale, 0 to 10, where would you rate your neck pain and that eye pain?
I don't have that eye pain anymore, and I think I can still feel it a little. So probably just like a 1. Yeah.
Okay. Well, excellent. So like I said, I have the exercises up front for you. We can go up there and see my receptionist Goose, and he'll go ahead and schedule you for some more appointments that fit your schedule. Okay?
Okay.
All right, that's great.
Thanks.
Thank you.